Hospitals and health systems never stop working to advance safety and quality around the patient care experience. Yet, we know the best way to make care safer and better is not more regulation. Rather, it's the field's ongoing collaboration and innovation to drive safety forward. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hederle with AHA Communications. Today's podcast is the first in a new series called Safety Speaks, a forum for hospital and health system leaders to share their passion for accelerating patient safety efforts in hospitals and health systems across the country. Host Robin Begley, CEO of the American Organization for Nursing Leadership and Senior Vice President of Workforce with AHA, is joined by Dr. Tom Peterson, Vice President and Chief Safety Officer with Trinity Health, to share how Trinity's approach to both patient and workforce safety is paying off.
Hello and welcome to Safety Speaks, brought to you by the American Hospital Association's Patient Safety Initiative. I'm your host, Robin Begley, and today, like every day, we're dedicated to empowering patients and healthcare professionals alike. Our goal is to foster engagement in patient safety initiatives, bolster public trust in hospitals and health systems, and promote the uptake of evidence-based measures to ensure the highest quality of care. We concentrate our efforts on three foundational pillars: fostering a culture of safety, identifying and addressing inequities in safety, and enhancing workforce safety. We convene stakeholders and support our members as they continuously transform the landscape of patient safety. Joining us today for Safety Speaks to discuss workforce safety is Dr. Tom Peterson, Vice President and Chief Safety Officer of Trinity Health, a leader who has been instrumental in steering transformative safety initiatives across Trinity Health. Tom, welcome to Safety Speaks. I'm looking forward to exploring your journey and discussing the impactful work you've been doing in patient safety and workforce safety.
Well, thank you for having me. Much appreciated.
Tom, can you start by sharing your motivation behind creating such innovative and strategic patient safety solutions at Trinity Health and how your approach has evolved over the years?
Sure. Yes. I would say quickly, in a nutshell, as a pediatrician, I think I naturally have a lot of interest on the preventative side of the world. And I also have a significant interest in changing situations that I feel need big changes. I've been involved with areas such as tobacco control for 30 years, the safety work for 20 years. And I think these are really focused on areas that I see big changes needed. So that's been kind of my driving force. I think the big interest in my journey, it basically has been over the last 20 years, I've been in 4 organizations building safety programs. It all started with a CEO at a children's hospital who said, I want to be the safest children's hospital in the country. And that was my deliverable I had to find for him. And we built a program, and that's kind of where it all started. Back then, this was when soon after the safety efforts had just started, the HRO thing was just coming into play, lean management, all those things were just starting. So I've kind of evolved over the years. I've kind of evolved and seen how, the HRO thing, I think, is a little bit of a term, but I think the organizing process is really what we're always looking at. And driving towards zero is always a big focus. So I think it's evolved for me. But then a big evolution for me was 10 years ago at a place where I had an HR executive who really was passionate about the worker safety world. And I knew nothing about it at that time. Everything was just patient safety. We were clinical people. That's kind of the world we came from. And taking that on and finding out one of his statements that's always stuck with me is, you cannot have safe patients without having safe employees. We call them colleagues at Trinity Health, so you'll hear me say colleagues, without having safe colleagues first. So that, and also it's a big issue with us being a leader in serious injuries to our employees or colleagues of all organizations in the country in healthcare. So that has been added into the journey and the focus as we've come into Trinity Health.
Thank you for tuning in to this episode of Safety Speaks, the podcast series dedicated to patient safety, brought to you by the American Hospital Association. I'm Dr. Chris DiRienzo, the AHA's Chief Physician Executive and a champion of the AHA Patient Safety Initiative. AHA's Patient Safety Initiative is a collaborative, data-driven effort that lifts up the voices of individual hospitals and health systems into the national patient safety conversation. We strive to catalyze and connect healthcare professionals like you across America in your efforts to innovate and improve, and to bolster public trust in hospitals and health systems by helping you share your successes. For more information and to join the 1,500 other hospitals already involved, visit aha.org/patient safety, or click on the link in the podcast description. Stay tuned to hear more about the incredible work of members of the AHA's Patient Safety Initiative. Remember, together, we can make healthcare safer for everyone.
Thank you for sharing a little bit of your journey with us. Can you tell us about the Zero Harm program at Trinity Health and its impact on patient outcomes? You mentioned zero harm a little bit ago, and that was, I think that's a natural next step.
Sure. I think these, whatever term you use, for me, zero harm, HRO, whatever, ours is called Together Safe. That's the name that we gave the program. I've always built this over, as I build these programs, I've always liked building it on the back of what the John Cotter approach for change management, which is the 8-step change model. You create an urgency, you get your leaders, you get your coalition built, you get your vision, you break down the barriers, you start building your army of champions and so on, your foundation, and then you start showing short-term gains, and then the sustainability comes after that. So that's always been kind of the backbone of how I've done this. I think for the work at Trinity, it's been, obviously it's the biggest organization I've been at. So much of it has been very focused on, since we have, and one thing that attracted me to Trinity is I knew the senior leadership was very committed to this, but also very committed to both the colleague safety as much as the patient safety, which I think was wonderful. But it's been because it's so big in so many states and over 100,000 employees, et cetera, I've had a very focused effort. Plus, we've had the years of COVID when I came here in 2020. So it's been a focused strategy approach. And that's what's really come with our colleague safety work is we find 85% of our OSHA recordables or the serious injuries to our colleagues are from 5 areas. So that's really how we've driven our focused interventions and efforts in those areas to have the outcomes that we want. That I think is one is a good approach. There's really no book on how to do this in healthcare for worker safety, in my opinion, that we've had yet. But I think it works very well, but also because it's such a large organization, that's also been important.
You've had such an impact on so many people, you call them colleagues and, also patients. Very impressive. How have your various initiatives, I know you've spearheaded the Smart Move program and the Workplace Violence 5-point plan as 2 examples. How have these contributed to Trinity's goals in patient safety?
Before doing any of it, it's very important, in my opinion, I've always followed this 3-phase process where you have to really build the foundation. We've had over 100,000 people trained in safety behaviors, things like that. You have to have very good data to drive the efforts. You have to have leadership committed and the frontline commitment, et cetera. And then as you build the colleague safety efforts, and those are 2 of the efforts that have, I think, been quite interventional. Nurses and CNAs are at the top of the list of strains and sprain injuries that put them out of work in the country, including all organizations. And that is to me not only an opportunity, but we have interventions like the bedside mobility assessment tool. When it's used and they use devices every time they move a patient when they should, you cut their injuries in half. So it has a huge effect on as an intervention. But then as we started seeing falls, and we're working on falls, and we see the handling of patients, and we see worked with early mobility, the thinking was, well, let's put this together. These all kind of overlap. So our falls work, our patient handling work, and our early mobility work, we put into the Smart Moves program that we're just kicking off right now as a focused effort. On the workplace violence side, it's been a very comprehensive. We have some of our regions that are ahead of other ones, but we have a very comprehensive focus. On the prevention side, we use what's called the Brosette score. So we want to have over 90% of all of our patients in the ER and the hospital scored, so they have the scored risk. Then people can use this as a plan and make sure they have plans for them every single day. And it has to be sent up to their tier 3 huddles, et cetera. There's a three-tiered training program for everybody where we have from the de-escalation to the middle training to the more intense training. The policy piece, so the code of conduct that you've heard a lot about, and we have the zero tolerance. That is something we have in one of our regions. We're going to spread it to our whole organization, hopefully this year. Strong responses from our leaders when people are injured or have a workplace violence injury, and also the data piece. So we now have developed in our dashboard that I'm quite proud of, that we have a focused dashboard that focuses on metrics. We have 6 major metrics that every ministry, we call the hospitals ministries, every region, everybody can pull up anytime and see where they're at in the journey. But we have a new one on workplace violence alone, where our focus is to get more and more events reported with less and less serious injuries to the colleague. And they have gone down about 10% in the last year.
So you're talking, Tom, a little bit about metrics. Are there some specific data or metrics at a high level that maybe we could share with our audience that highlight the measured improvements in patient safety at Trinity Health as a result of all of these many comprehensive initiatives?
One of our things I think we did was picking out some basic metrics that it's so big and there's so many types, especially in the patient safety areas. There are metrics galore. And so it was really focusing on certain ones, putting them in so everybody could have them. We have a 6-point scorecard that everybody can get and share to their executive leadership every month, et cetera. And I think another thing that's really important in safety to me is you've got to have really good visuals. You've got to have visual improvements to show in your huddles, to show to the leaders. And so that's been a big part of the metrics as well. But we have basically chosen the OSHA recordable. So that's our rate that we follow. That's the standard one that everybody in the country uses, healthcare, non-healthcare. You can compare yourself with Amazon and Walmart if you want to, because the metric is basically the same. And so it's a great metric that we can follow and also see where we are benchmarked with other hospitals in the country. We have our other one is we have 2 falls. So we have serious preventable falls that we follow on there, as well as our all falls rate. Both of them have gone down significantly in the last 2 years, as well as our OSHA rate that's gone down. And then we have event reporting. I still need a lot of work to do with that. It's gone up in the last couple of years, maybe 15% or so, but we want that to go through the roof with event reporting, especially at our unit level. And then we have we have surveys. So we do 4 or 5 questions on safety questions that come out of the HRQ survey. We do those 3 times a year to put those in to see how people can follow how they're improving in their safety culture work. And then we also had a focus on surgery events because we had a big issue with those a few years ago. And that's had a huge decrease of about 75% with our intervention, our 6-point surgery plan in the last 2 years as well. And finally, our last safety metric is the serious safety event, measuring preventable serious harm events to our patients. We've dropped this one by about 40% in the last 2 years. Those are the basic ones that we have for the safety scorecard, the metrics that we use. Now, there are other metrics. There's HAI metrics. There's a lot of other sepsis metrics. There's other ones people follow and use, which we do too. But at least for our safety focus, those are what our scorecard includes.
Wow, so you must have a team that helps collect all that data and, present it in a manner that's meaningful for our clinicians and for our leaders.
The thing we've been lucky with is we have a big support from our senior leadership, as well as the skills and the ability at all of our regions. So we try and standardize everything as much as we can. When I came in, there's a lot of variability in the safety program and safety training and things like that. So we tried to standardize everything, including the metrics. That was another purpose. I kind of saw this in a one-page report I saw from the VA system years ago. They did this really well. So that was kind of the idea. But they all tend to do this. We have a central place where they send it. It's all Tableau based, but we have a lot of focused, skilled people at our regions and our hospitals as well. So
Wow. Impressive and really comprehensive work. Those are the words that keep coming to mind. And now I've got a question that is rather near and dear to my heart, being a nurse leader for so many years. Considering the critical role of nurse leadership in shaping patient care, how do your initiatives at Trinity Health integrate some of the nursing insights and leadership, to drive improvements in patient safety at Trinity?
Well, I think, one thing I've learned over the years in healthcare is when you work in safety, whether it's with the colleague safety or the patient safety, the nursing is an incredible backbone. I mean, it is a make or break kind of area because one, it is so many of your colleagues. It's such a large population. Secondly, they have such a hands-on to the day-to-day care, with everything from the falls to the pressure ulcers to the medication use, et cetera, et cetera. They're really an area that you have to have as part of your safety work. And ours, I think we've done very well with that. We've had a lot of nursing focused areas on the safety. I would say from my perspective, there's been a lot of the nursing has to completely support the smart moves and the safe patient movement program that is basically all nursing based. They're very engaged in the workplace violence advocacy because they are engaged with these patients every day and they have to score them every day. Sharps is a big one for nursing. We have a lot of contaminated sharps injuries as they give injections and medications and so on. So they're part of that as those teams that meet regularly. We have safety supported by a virtual nursing effort that our system is doing. All of our nurses went through the basic safety training that everybody did, and they will continue that as they're onboarded. I think they've been a significant component. I think the other thing I like to say too with safety, if we do this really well, in my opinion, is it kind of is what I call it. The rising tide lifts all boats, right? So the statement I like from one of my mentors at Alcoa was, if you do safety well, everything follows, or you do everything well. And that is a huge part in the nursing world of how we do this with safety. That helps patient experience, that helps with turnover, that helps with the colleague engagement components, that helps with all the other aspects that we're trying to improve in our hospitals, in our centers every day. So,
Well, thank you, Tom. Any final words before we conclude?
well, I would just like to say, first, thank you for having me, and thank you for giving us a chance to talk about our safety work. Like I said, we have a great support from our leadership here at Trinity to do this. It's going to be a journey. It's going to go on for a long time. Hopefully, my big key is to build something that is sustainable, and no matter who's here or who comes and goes, that's still there, like you see in some of the other non-healthcare places where they've had safety as part of their backbones for 30, 40 years. That's kind of one of my dreams with this process, as well as really trying to get some of these numbers to some of the best that we can get in the country. I think those are big opportunities.
So I'd like to thank you, Tom, for joining us today and for sharing your valuable insights and experiences in advancing patient safety at Trinity Health. Your dedication and innovative strategies serve as an inspiration to all striving to improve healthcare outcomes with their respective hospitals and health systems. For our listeners, if you're interested in delving deeper into the topics discussed today, we have an expanded slide deck available exclusively for participating PSI members. If your organization is not yet signed up with the AHA Patient Safety Initiative, I highly encourage you to join us. By becoming a member, you gain access to a wealth of resources, collaborative opportunities, and the latest research aimed at fostering a culture of safety across healthcare settings. You can sign up and learn more by visiting the AHA Patient Safety Initiative webpage. We thank you all for listening and hope you continue to engage with us. Together, let's keep the conversation going and work towards a safer healthcare environment for everyone.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.